Hi, my name is Vidisha Gupta. I am your host for today, and I welcome you to today's podcast, Win Over Hypertension. Through which you can learn how to take control of your high blood pressure through exclusive insights and practical advice. And today, we're talking all things about hypertension, why it matters, how is it caused, and most importantly, how to manage it effectively. Hello, doctor. It's my honor today to welcome you on this podcast, Win Over Hypertension. And I guess today we will be needing all your insights on how to manage high blood pressure and hypertension.
Hello viewers, Namaskar. I am Dr. Priyadarshi working as a consultant cardiologist at Santi Memorial Hospital, Cuttack.
Okay, doctor. So my first question to you today is, we all know what hypertension is, but can you please elaborate on it? I mean, why is it so important that we take care even when we are feeling fine?
As we know that when the blood pressure rises above 140/90, then we usually call it as a hypertension. And hypertension is a systemic disease. It affects whole body organs from head to toe. It affects from head to toe like your eyes, heart, kidney, and peripheral vessels. So by the time it was detected, most of the organs are affected. So it is also known as a silent killer. So everyone should be aware of it, whether I am having hypertension or not. So we should measure our blood pressure regularly, even if we are feeling very fine. Even if some slight symptoms like headache, weakness, dizziness we feel, we should measure our blood pressure regularly. And for an elderly person, it's very important that they should measure their blood pressure regularly. If we will not do that, we may miss important disease, and once it is detected, by the time major important vital organs are affected.
Doctor, why is it so often called the silent killer? What makes it so dangerous over time?
Hypertension is a silent killer. What do you mean by silent killer? Means unknowingly it is affecting every organ of the body, from head to toe, from eye to the heart to the kidney to the peripheral vessel. It affects whole organ of the body, and by the time it was detected, most of the organs are already affected. That's why hypertension is a silent killer. I'll give two examples, like rust in your concrete. By the time you will detect your rust in your concrete, it is already weakened the concrete. The termite in a log of wood can destroy whole body. Similarly, the hypertension, if undetected, can damage most of the organ of the body. In the eye, it can cause hypertensive retinopathy. In the heart, it may cause ischemic heart disease, dilated cardiomyopathy. In the kidney, it can affect the glomerulus and can cause acute kidney injury or chronic kidney failure. Peripheral, it can cause peripheral arterial disease. It initiates the atherosclerotic changes in the blood vessels and affect most of the organ of the body. The data showing that 54% of this stroke is because of hypertension, and 24% of the coronary artery disease is because of hypertension. So hypertension is one of the important cause of death in our Indian setup. So my advice is to check your blood pressure regularly. Know your number. What is your blood pressure? Even if you are 18 years of the age. And treat accordingly and take care of your body.
What are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
If we'll discuss about the causes of hypertension, it is mostly a combination of genetic and the lifestyle changes. The cause of the hypertension, either it is a modifiable and non-modifiable causes. In non-modifiable causes, it is either genetic. It runs in the genes and passes from one generation to another. So second is your with age. With increasing age, the stiffness of the arteries increases and that lead to hypertension. If we'll discuss about the modifiable causes of hypertension, it is either obesity, increased intake of the salt, sedentary lifestyle, obstructive sleep apnea, and increased stress. So few things we can change and few things we cannot change. Suppose we are having some genetic causes of hypertension. My father is having hypertension and that is comes to second generation. So genetic causes, you have to be more careful about the hypertension. We should take care of our blood pressure regularly. We should reduce our weight. We should avoid fatty foods. We should reduce the salt intake.
How is blood pressure really diagnosed? Can you please elaborate on the exact numbers patients should look at while looking at their blood pressure readings?
Once the blood pressure is more than 140/90, and we usually call it a hypertension. And once it is diagnosed after the repeated episode of reading, don't be panic. It's a normal thing. We can live with the hypertension safely. So we have to be careful about our lifestyle changes. Lifestyle means your diet and exercise. Do minimum 30 minutes of exercise every day or minimum 5 times a week. Walking, jogging, swimming, and cycling are better exercise. Along with doing yoga, pranayama, that reduces our brain and decrease the sympathetic activities, and that leads to reduction of the blood pressure. Next come our food habit. Reduce your sodium intake to minimum 1.5 gram per day. Don't take extra amount of salt in your diet. Avoid packed food, spicy food, and avoid fatty foods. Also reduce your cholesterol, high fat diet. Once the blood pressure is associated with dyslipidemia, it increases the chances of atherosclerosis. If you are interested for non-veg item, then prefer fish that is rich in the omega-3 fatty acid. Also reduce your weight. Do regular exercise. Quit smoking and alcohol. If we can do some small changes in the lifestyle, we can reduce the blood pressure up to 5 to 15 millimeter of mercury.
Okay, so for someone who's just been diagnosed with high blood pressure, what are the changes you would want them to make in their lifestyle first?
Sometimes this blood pressure gives very little or minimal symptoms, so we should measure our blood pressure intermittently. Once the blood pressure reading is more than 130/80, according to latest American Heart Association guideline, then we usually call it a hypertension. But you should not do a single reading. Usually 2 readings 1 minute apart should be taken for diagnosis of a hypertension. The person should not take any coffee or smoking 30 minutes before the reading. So in a calm and cool place, you measure your blood pressure properly, and if the reading is more than 130/80, then we can call it as a hypertension. Usually what happens when the patient come to the doctor, then usually he is in a stress, and that lead to false increase in the blood pressure, that is known as white coat hypertension. So the ideal time is at your home, when you are calm, cool, relaxed. Then measure your blood pressure at least 2 times, 1 minute apart, and that gives a real blood pressure of your own. So if it is coming more than 130/80, then it is known as hypertension. Another thing is coming ambulatory blood pressure monitoring that gives you a regular baseline blood pressure level. That is the ideal blood pressure monitoring for diagnosis of a hypertension.
So can we say that hypertension can be treated without medication also?
Yes, in the early stage of hypertension, we can go for a lifestyle changes. Lifestyle means your diet and exercise. If we will go for a regular exercise, minimum 30 minutes per day and 5 times in a week, we can reduce your blood pressure. If we reduce our weight 10 to 15%, we can reduce our blood pressure significantly. If we cut down our sodium intake to 1.5 gram per day, it will reduce your blood pressure. So there are some diet plan like the DASH diet, dietary approach to stop hypertension, the diet rich in the potassium, like potassium rich vegetables like fruits and broccoli, all this reduces your blood pressure also. So if we can go for these lifestyle changes at early stage of hypertension, we can manage the hypertension without any medications. Yoga and pranayama are one of the important factor in reducing the hypertension that calm our body, mind and soul, and that will reduces the blood pressure, that reduce the intake of the drugs. If we think about the drugs of the hypertension, there are several kind of drugs are available in the market with some of the side effects. If we take diuretics, we'll having more dehydration, generalized weakness. Beta blocker may cause some fatigue. ACE inhibitor that are contraindicated in pregnancy, and calcium channel blocker, it has some pedal edema like side effects. So every drug has some amount of the side effect, but with the drugs, if we can go for the lifestyle changes, diet, exercise, we can control the hypertension in a better way.
You just mentioned that people should reassess it regularly. How often people should check their blood pressures? And what's the best way to do it right?
In the initial stage of hypertension, we should measure our blood pressure daily. In the minimum in the 2 times in a day, in the morning and in the afternoon. That will give a mean blood pressure measurement. But once it is settled with medication or lifestyle, minimum 2 to 3 times in a week is sufficient. Again, this home monitoring is better than the office or hospital monitoring. Ambulatory blood pressure monitoring is better than a single time blood pressure monitoring. People often ask how we'll measure our blood pressure. You should sit quietly with arms supported, measure your blood pressure, put your blood pressure cuff and measure minimum 2 readings, 1 minute interval, and give the mean blood pressure. Again, if we will not control our blood pressure, if it is uncontrolled, then it will affect most of our organ of the body. In the brain, it will causes stroke, brain stroke, which is fatal and hazardous. In the eye, it will cause blurring of the vision, macular edema, hypertensive retinopathy. It causes, in the heart, it causes hypertensive heart disease. It causes dilated cardiomyopathy. It causes coronary artery disease. In the kidney, it causes chronic kidney disease. In the peripheral vessels, it causes spasm of the peripheral vessels and peripheral arterial disease. Hypertension causes stress on the endothelium of the lumen of the blood vessel. So that lead to some aortic aneurysm or dissection. So if we will not control our blood pressure to a particular limit, then it is hazardous and fatal event will occur definitely.
What can happen if high blood pressure is untreated for years? What are the body parts which are most at risk? So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to our doctor for such valuable insights. Remember, that hypertension isn't just a number, it's a signal, and with right practices, we can manage it effectively. Like the podcast, please don't forget to like, share, and subscribe, and leave a review for us. Just remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta, your host, signing from the podcast Win Over Hypertension.